friends. Welcome, welcome, welcome. It is, yes, another super fabulous Sunday here, PowerTime. This is your hostess, Sharon Herbert, the Power RN, coming to you live from Power in Nursing Innovations. So, welcome, welcome, welcome. We have actually a fabulous presentation today. And as of course, it is all about nursing. All about nursing. I am so fabulously grateful today and every day to have chosen the career path of nursing. And here you are today. So we have to look at today and determine where the future lies. What is the future of nursing? Where are you now? Just a thought. You don't have to say it out loud. Where are you now? And are you prepared for 2025 and beyond? Ooh. If you're prepared, let us know. We're starting a little early today, so if you by chance meet us up on the replay, please just indicate #replay. And you can still have questions or comments. If you share them there, we will respond to you ASAP. But let's get moving now, as we're talking about preparing for 2025 and beyond. Have you had any thoughts about nursing in 2025 and your space or place in nursing in 2025 and beyond? If you haven't chosen to think about that, it's getting closer. It's getting closer. So let's get a moment to reflect that yes, it's getting closer. Today is December 8th. So let's move forward into thinking about the future. And thank you for joining me today as we explore the future of nursing and what we as nursing professionals need to prepare for our ever-changing and evolving world of healthcare. You know, we've had some similar challenges for some time. And as we know, nurses have to go through certain struggles, and we do again and again. Nurses, as we know, are not just caregivers. Not just caregivers. We're not the cleaning lady. We don't do laundry. We are advocates and educators and leaders. And we are, yes, the backbone of the health care system or systems. In the U.S., yes, and even worldwide. But let's face it, there are certain challenges that we continue to face, that it's just like any other business or organization or budgetary planning programs. We go through the same things over and over. Those like staffing shortages. Really? Yes, you've heard of that before. Burnout? Yes. Lack of autonomy. We always have to have someone deciding for us who we are and what we do. But we can do better than that. Those challenges have not disappeared, but you might think, indicate, or remember that those challenges haven't disappeared. So the demands that are placed on nursing all the time, and especially we learned a lesson of that through the COVID pandemic time. So many demands placed on nurses. But even through those times of those demands, there were issues that came to light. And addressing those issues didn't always come out to positive responses or solutions. And we have to keep thinking again, thinking about those challenges and thinking about how to change the problems so that we can solve the problems and have best outcomes. We know that. And that means we have to think. We have to think and create strategies to solve the problems. Wow, that wasn't really uh, a brain breaker or a brain buster. But today, we'll share some insights as to how nurses can shore up our practice. Our practice is created, and though there are rules and regulations, and that is the space we function in, but there are sometimes we have to enhance our practice. We have to make some changes. We have to be flexible. And in those changes, it may put a bigger burden on nurses. The high volume and sicker patients in COVID really put a strain on nurses because we are human, yes, and we are human. And we have to make changes, but sometimes those changes really affected the practice of nursing because we are human. Yes, we have to eat. Yes, we have to sleep. Yes, we have to think. Yes, we have to care. Yes, we have to be advocates, and we must have compassion in the process. We must put ourselves in a position where we are not often and always at risk when we are serving the patients and customers in the world. So, and in that time that we are serving, we are thinking. Yes, we're always thinking, and we're observing, and we're implementing, and we're looking at the sphere of the problem and the practice and looking for best outcomes. So if that all goes well, and we've gotten a chance to go through the process, and somewhere in there, we also got a chance to have a potty break and to eat something, it comes out to a better outcome for the nursing staff and more likely successful for the client. It's really difficult to think and work and observe and practice when you haven't eaten and or you really have to go to the potty. We are human. And so as we look at the future of healthcare, we understand based on where we are now that some of us came into the nursing practice when there was pencil and paper. That's how we wrote down notes. The physicians wrote their orders on a piece of paper, and then someone had to practice to really acknowledge or read the writing and determine what those words or letters meant and process that to get the medications from the pharmacy. You had to send the order to the pharmacy. Who remembers the telelift? Who remembers? So those were the days. And things have changed today. Technology and innovation are at the crux of everything we do today. Doctors don't write orders on a piece of paper. That's not how it's done. And we have to look to the emerging trends in healthcare. Some of those are related to technology. Now, we know technology. We'll talk about computers, but I want to tell you way back in 2000, in the place where I was working, two staff members just said they couldn't take it. They couldn't take it anymore. If we're starting using computers, they said, oh no, I've got to quit because I can't do it. I can't use computers. And that was a good time ago. But guess what? We're still using technology and more often. And by 2025, we will not be surprised when someone talks about AI, artificial intelligence, telehealth, or even wearing devices where you can connect with your patients or members of your healthcare team. We have to be ready for that. These tools are coming, and how will that affect your practice? Have you thought about that? Have you thought about that? It's continuing to grow. And the focus is really on best practice and best outcomes for the healthcare providers. We want to make things legible, and quality measures are a part of this practice as well. And what about your aging clients and patients? How will they fit in the core of this practice that now contains artificial intelligence and other telehealth measures? Are they going to be able to understand and to advise you whether they do or they don't? Because if you're using it snappy, everything is good for you, but your patients don't understand, there's probably going to be a few challenges. And we don't want any of those. And I want to say, danger is right here in the focus where many of your patients are older and or they have chronic illnesses. That's going to be something we really need to pay attention to, because you have to connect and communicate with your patients in order for them to be served successfully and for you to be successful in your service. You must communicate and connect with your clients. So that's important. Focus on your patients and your population. If you are a diabetes educator, you know what the crux is of the education plan. But you surely need to make sure each and every client understands what you're telling them or showing them. You can't just speak and just let the whole class sit there quietly and then say, okay, we're done. Danger. Pay attention to who your clients are and how you are serving them. Very well. So, what changes about your practice outside of the use of those electronic devices or measures? How does your practice and your workforce or work related measures change from yesterday, from 2020, from 2000 when my colleagues left nursing because they said, oh no, can't do this? Staffing is still a problem. Staffing shortages still exist. And after COVID, so many nurses left nursing. How do we manage to shore up the volume of qualified active nurses so that we have enough nurses to provide the care and even lead and mentor new nurse professionals? We've got to have enough staff. That's a challenge still, and it has been for a long time. But even as we talk about the numbers of staff, how do the numbers make a difference in what nurses do? Because a nurse is not a nurse, is not a nurse, is not a nurse. Every nurse is not the same. And really, COVID was an awakening for many nursing staff, but the community had no idea how COVID and retirement of many nurses made a change in the service that would be will move beyond traditional bedside care, which, the public thinks, well, you're a nurse and every nurse is a nurse. Well, nurses have taken on new roles, and some of those are leadership, coaching, consulting, being advocates, moving on to advanced practice, as in nurse practitioners, doctors of nursing practice. A nurse is not a nurse is not a nurse. So how does the practice and the change in roles coincide with the road and the journey to best outcomes for the patients and best practice for the nursing profession? Well, if you have an answer for that, please let us know. Because the crux of many of the successes and satisfaction in nursing was highlighted by the pandemic. You can't get one nurse to do every single practice. A diabetes nurse is not a psych nurse, is not an OR nurse, is not a pediatric nurse. So, what helps us to understand and to help others understand? What about human resources? How do we strengthen the ability of human resources to put out their flag to look for new nursing staff, to fill the blanks? What best strategies can they implement to be more competitive in their journey and or to offer better benefits to retain folks who are already there and to attract new nurses? There are so many opportunities to look into human resources, to help them to make the right choices and offer the right strategies to those persons who may be available to come aboard. So we have to look at nursing that way and let other persons know that we are all not one and the same. And even during those times, you may just want to change. You may want to change your position, and that change may require professional growth. If you've been a med-surg nurse for 2 or 3 years and you've seen and learned a few things, maybe you have decided that you want to be a nurse practitioner. That will require you to move and grow. And there is professional growth, professional development matters that you can review and find where you might want to go and how to get there. Maybe you want to be a nurse practitioner or another high demand specialist, whether it's psych and mental health, whether it's diabetes. There are many, many, many options and opportunities for you to move ahead in the nursing profession. Those things like geriatrics, there's informatics, and we talked about mental health. There are so many ways for you to move forward and still help the community that relies on nurses to help them grow into the best new grad, the best clinical educator, the best OR nurse. We talk to each other a lot. So ask your colleague who has completed the program in psych and mental health nurse practitioner. Ask them. Maybe they are a few people that you have, graduated with, and now they are working in the operating room. Ask them. And we have to speak up for what we want. If you choose to become a leader, and even if you don't, there are times that are coming now that you must participate in what's going on in your organization. Decision making is important. You can't just let the world fly by and let someone else make all the decisions for what your schedule will be, how many hours you will work, what days you will work. Oh, and we do have that Christmas, New Year's, and other holidays, and your vacation. Who makes decisions for you? You've got to take part in decision making. As well, you need to stay current on what's going on in your organization, in the world of health and wellness, and really, even in the newspapers and in articles today. And you all know I'm always reading headline, X organization is laying off 75 healthcare workers. I stopped there because I knew I was coming here today. But how do you know what's going on in the world? Pay attention to your local health and wellness organizations, as well as the leaders of those organizations and the services that they provide. Every hospital does not provide pediatric care or surgical care. You've got to pay attention. What's the lowdown in your schools today? Remember in the days where there was a school nurse in every school? Not so much anymore. So pay attention to what's going on. And listen, if you have children in those schools, listen to what they tell you. Listen to what they tell you. And don't take it for granted that when your child tells you there's no nurse in their school, pay attention and look and listen to what they're telling you. And remember, as we talk about providing service to others, don't forget yourself. Don't forget. Self-care is still so important. And I know that we talk about self-care and people say, oh, yeah, self-care. Okay. You are important. You are important. And remember, self-care is not selfish. It is necessary. How can your customers and clients receive care if you're sick and you're sick again and half of your unit is out sick? How will we care for anyone else if we are sick ourselves? So burnout is still alive. Burnout prevention is so important because we need to eat, we need to sleep, we need to have time for ourselves, and mental health is so important. Don't think that, you won't have a challenge with physical or mental health issues because you're a nurse and we don't get sick. Well, let me tell you that that is not true. That is not true. But remember, you've got to take care of you. And it is hard. It is difficult because our schedules are here, there, everywhere. How many admissions can you take if you're in the ICU? And during COVID, there was no number that was the max that you could take. It was more, and more. And how many of you actually got to work in a place that sponsored wellness programs for nurses? Now, in the midst of the first year-ish of COVID, no organizations really wanted to say that we aren't going to acknowledge that nurses will need to be cared for like any other person that's working in the organization. Yes, and yes, we have to eat, we have to sleep, and we have to care for ourselves. At sometimes you need to be hydrated, and even when you're eating, you can't just eat junk food. We have to have positive influence on the decisions that are made in our organizations about the care for the health care workers. You will be sick if you don't get the nutrition and the rest and the hydration that you need. And many of us, really, as we've done this role a long time, we really need to have a break. Mental health is important as well as the medications that we may have to take. So we are human. Once again, we are human and we must acknowledge that we need to pay attention to what we need to be healthy and well every day so that we can take care of the persons that need our care and to return home to our families and friends positively positive. I know so many of my friends, there's been more than one, that fell asleep at a stoplight. We've got to care for ourselves. And we can't say, next time we'll pay more attention, because that's not the answer. You've got to pay attention to yourself. And absolutely, absolutely, there is no one that can replace you. You are irreplaceable. 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 Do you hear me? Irreplaceable. We can't think that we'll do it later, we'll eat later, we'll sleep later. And we've also heard stories of folks who didn't make it through COVID because they weren't able or didn't, whichever you choose, care for themselves. Now you must make sure that you are part of the decision making process in how much you work, how long you work. We know that mandatory overtime is still a challenge and it hasn't gone away yet either. But remember as well, as we're heading towards 2025, there will be changes in the healthcare systems and in the access and or quality that your clients, customers will get before they get to be served in a health care organization. Did you realize that there are so many general practitioners that have just said, nope, can't do it anymore. Nope, don't want to do it anymore. I'm out. One, I'll just tell you one good thing is that nurses are still growing. Nurses are still growing in their practice, and one of the greatest spaces is the health and wellness of folks who are having mental health challenges. And it is good that we are growing in that platform because you may even find your own self in that place and space where you just can't do it anymore. You've worked 7, 8, 9, 10 days in a row, 12 hours, 8 hours, and 16 hours. You need help. And help is okay. Help is good. Take advantage of all of the support systems that are available in your organization and in your community. Get together with your colleagues. Many are having those same challenges. Talk to each other to help yourselves understand that it's okay. It's okay to ask for help, and whether you are sitting in your back seat of your car because you don't want anyone to see you crying, find yourself a forum to help you. There are formal and informal groups. If it's just enough for you to be able to exhale, or to have a nice lunch with two or three of your colleagues. Get together and support each other. You've got to. And we talked about mental health. And I will tell you, in my darkest days, I thought, well, I can tell the, patients or parents what road they can choose to get help in response to the stress that they're going through when now their newborn baby is in the NICU, on the on the ventilator, intubated, and this baby is a 25-weeker. On top of the fact that they have all of these machines, they're so tiny, and no one has ever thought that this would be the baby that they would take home. And they're afraid. And they have a right to be afraid. And so do you. Understanding what they're going through and advocating for them is so important because we don't know everything. We don't. So, yes, you can find members of your healthcare team. You can find your supervisor and or your social worker to help you to help them. We have got to prepare ourselves to help others always. And we can't say, I'll do it later. I'll do it later is not going to be the answer to the problem for your clients and your colleagues. So we've got to plan, make a plan for the future, as we know that more and more people will be coming to the hospitals with chronic illnesses as their general practitioner has closed his or her doors. They're going to need help. And where will they go? They will go to the emergency room looking for assistance. And they will find you. They will find you. And they want you to be on your P's and Q's and able to assist them. So let's prepare. And how do we do so? How do we plan and prepare for success for these new customers who have lost their general practitioner and they don't know where to go or what to do? We've got to create a plan. And we're still on the ship, the advocation ship, and we're still using technology, new innovations, and there may be things that your clients don't know how to do or how to spell. You've got to be able to help them. Technology is here. So you must embrace technology as the tool that enhances our work, not the one that replaces us. They still need us. They still need us. Our care, compassion, and our thoughts and our brain. So we have to be proactive in learning the new systems. I told you about my colleagues that left back in 2000, but we're here to serve and benefit our patients and to help them to best outcomes, as well as helping ourselves and our colleagues to stay alive. Staying alive and finding and revisiting your purpose and your passion. reflect on your why. What is your why? Why are you here? And whether it's patient care or mentorship or leadership or advancing your practice, you have to understand your purpose and what will keep you motivated. Are you still in love with what you do? That's a moment for you to think. Are you still in love with what you do? Don't wait for recognition. We know that it has been a long time singing the same song about staffing, about salaries, about mandatory overtime, about days off, weekends, nights, holidays, and how I don't believe that the C-suite really acknowledges the value and the worth of nursing. I've heard that one. Have you? So remember, don't wait for recognition. Claim your own seat at that table. You are looking to serve and save, and to do it with care, compassion, and kindness. And that is who nurses are. Bring your skills and your passion and your purpose and, of course, your power to the table. Stand up for yourself and show how you have worked moving forward, as you always have, to care for your patients and give them A+ service. A++. In the meantime, don't ever forget yourself. As you review the new policies or even cultural changes, make sure to uplift each other. You are all fabulous. And I mean fabulous. Ultra fabulous, brilliant, and valuable as healthcare professionals. We know that we are. So there is no need to cry and whine for more money. But you must determine the strategies and the services that will help your clients have best outcomes, and it will be because of you. The value and worth that you have served your patients and clients will come back. It will come back on the CMS surveys. It will come back on the organization's requests from other providers for how you served the organization. Don't forget, your best is always valuable, and there's no need for you to do anything less. So, as we move towards 2025, make sure that you stay alert and aware of the changes in health care services and healthcare organizations. It is really going to be something that requires your attention. Requires your attention. We must be flexible in the system and offer our best. And together, as always, we can help shape healthcare to reflect the best care. The values are certain, and those always include respect for others, quality care, and success and satisfaction in outcomes for customers, clients, patients, and the healthcare providers. It is our goal, our goal to serve with excellence clear into 2025. And as you enter, just be patient, but not in the sleepy way. Let's look at who we are and what we do, how we serve, and how we can serve our customers with excellence. Be well, my friends. We are going to meet 2025 very soon. And we need to transform our own services and practice to meet the best for our clients. Transformation lies in our hands. Let's embrace the change and create a brighter future for all of us, for the customers, for the organization, for the patients, for the new grads, for the nursing faculty who are struggling and stressing through the creation of the next line of new nurses. Let's do well together, and in excellence we will rise. This is Sharon Herbert. Meet me again at Power in Nursing Innovations as we prepare for 2025 and beyond. The future of nursing is in your hands. Us at powerinnursing.com. We'll see you soon. Bye-bye now.